I think so, and I like to be very careful with that idea. I think a lot of the cases that we've heard on the national news are connected to the fact that some of the liquids or oils that were in those devices were altered, manipulated somehow. But that. With that idea, it's easy to assume that maybe if someone uses a device that is not altered, that could be maybe safer, and I would not make that assumption as of now. And even I think in the CDC data, there are cases that people are just using regular branded devices that still developed lung injury. So I don't think we know enough to make that conclusion. Although we don't know what specific substance or maybe the way that someone is using these devices is directly causing all these illnesses, I always tell that the only thing that they all have in common is vaping itself. So vaping it's not recommended, and nobody should be using. And there are so many different ways that can be used, and so it will be very difficult to isolate just one or a few substances, because one can be manipulated, and also because there are different liquids and products that are available for consumers. We're learning more and more about the short-term risks of vaping. Unfortunately, it will take a while for us to learn about the long-term consequences of vaping. And this strategy of selling the product as something safe is nothing new. We've seen this before with cigarettes. If we see those ads from the late 40s and 50s, there were even doctors on those ads trying to promote cigarettes and specific brands as safer than others. And the same technique again for vaping. A few weeks ago, I did go to a high school to give a talk to students and their faculty about vaping. And I had a long Q&A session, and a lot of the questions of the students were addressing that. They were weighing the risks and the benefits of vaping compared to other things like cigarettes. So for me, some of the questions are almost like they were really tempted to use, and they're really weighing to see which one is the lower risk, and they would try that, which for me I think is very dangerous. And this is what we're seeing now, trying to sell something that is safer, because they know that there is a group that will give it a try, and then after a try or a few more, they're already addicted to nicotine, and then they have consumers for years, or not decades. And I think for several reasons that is dangerous. Yeah, I feel that the medical community is being a little pressured to say out loud which one is the winner, which one has a lower risk. I think first of all, we don't have enough information to say which one is safer, and it depends how you see it too. It depends what the outcome is. Now we know more and more about the short-term risk of vaping. We still don't know about the long-term risk of vaping. Right now, the one that we know the most is the nicotine addiction itself. So if we compare the addiction between vaping and cigarettes, I'll say probably they are the same, if not even worse, because the electronic cigarettes may contain higher amounts of nicotine compared to a regular cigarette. So I would definitely stay away from try to give an answer of giving one winner. It's vaping versus cigarettes. Being very candid about an answer. I told a colleague once, which one is worse for cirrhosis, beer or vodka? So it's really hard to say which one is safer to drink. Well, you shouldn't drink at all. So I think the answer is, I've always advised not to smoke, offer treatment for nicotine dependence, offered for that is related to cigarette use or vaping use. So I think that's my best advice.